The Bromley-by-Bow Centre in East London takes an holistic and integrated approach to health and social care. Its tried and tested model is continually being honed and improved as the needs of the community change. At the heart of the centre, the GP partnership provides a vital service to the local community.
Essentially, there's two organisations working in the same building here. There's the GP partnership and there's the Bromley-by-Bow Centre. There's a lot of crossover in the kind of work that both organisations do for the health of the general community. We have a joint reception for the centre and the surgery, and the GP clinicians can refer to all the services available in the centre. We obviously deal with medical conditions day in, day out. However, we can only take those patients so far dealing with their medical problems. They often have social issues that need to deal with, housing issues that need to be dealt with, and other issues that are blocking them from actually moving forward in their health. So to be able to say to someone that I can help you with those things, rather than say, I'm sorry, I'm just a clinician, I can only give you advice around clinical areas, is a huge benefit for us. It relieves the pressure, particularly really busy inner city practice with all those social problems, but also we're helping the patient.
Someone who has benefited from this approach is Lisa Cunningham. A former patient, she now runs a horticultural project at the centre known as the Pollen Project.
We run various workshops based around horticulture. The main focus of the group is looking after a flower cutting garden and allotment beds that I'm sitting in at the moment, and they are for people who are experiencing mental distress, which is sort of an umbrella term for anxiety and lacking in confidence, people that are socially isolated.
Before becoming the Pollen Project's coordinator, Lisa had been referred to another horticultural project by her GP.
And I had been unwell with depression for 10 years at that point. I volunteered for 2 hours a week, which was all I could manage. I was always late because it was in the morning and I just could never get up in time. And I'd go home and I'd sleep in the afternoon. But by the end of the first year, I was being paid for 17 hours a week, and I had stopped taking antidepressants that I'd been on for 10 years and 11 months at that point. Here I am working full-time through 2 different funding streams at the centre.
In Tower Hamlets, GPs now working in networks. So working with the local other practices, we are able to send some of the initiatives we deliver here elsewhere. So at another practice on the other side of the network, we have the team for the welfare and benefits advisors. I think as a network, we do work very closely with the communities, so we're always getting feedback.
When people are referred to my project, I'm always surprised about the lack of sort of integrated systems that there are available to people. I think that that they're probably lucky to have been referred to us in one sense, that we are able to offer that kind of joined up approach towards people's social care needs. But I think that it's not common for GPs to think about people in a holistic way or in a non-medical way.
In Bromley-by-Bow, we can see how thinking holistically about the different types of care and support that people require and forging partnerships to deliver services in an integrated way has resulted in positive, lasting outcomes for service users.